117 travelers flew to the Philippines from India before border restrictions were imposed on April 29. 110 were quarantined, 6 of them tested positive for COVID-19. Their samples were sent to the Philippine Genome Center to know whether or not they have the double mutant variant first reported in India, the B1617. The WHO said this variant could spread more easily and could also affect the body's response to vaccine. Officials are looking for 6 other travelers.
That's the hope, no, that we can prevent the entry of specific variants into the country. Kailangan lang natin talagang pag-igtingin ng border control na kahit na makapasok man sila, itong mga variants na ito, dapat handa tayo.
The Philippines is already facing the consequences of having the new variants. The country first reported a variant from the UK in January and the one from South Africa in March. That same month, a new variant called P3 was also detected in the Philippines. But until now, the DOH can't say if there's community transmission of the new variants because they are only doing targeted sampling.
We get samples from those areas with clustering of infections, with linkages to specific individuals who turned positive for these variants, dun po sa mga areas na closed ng institution, dun sa mga returning travelers natin. So ito po, purposeful ang ating surveillance, so hindi pa natin mas ascertain kung talagang sila na yung prevalent na variants.
But even without the announcement from DOH, infectious diseases expert Dr. Regine Solantes said there are indicators the new variants are driving the surge.
We need to do more sequencing for us to really know the real picture of those who are having variants. Kasi kung titignan mo ngayon, that's 6,000. That's only how many % of the total tested.
Former National Task Force Advisor Tony Liachon echoes this, adding the government should also be more proactive.
Yung India, nag-surge yan April, maaga, early part of April, dapat nag-travel ban na nun. Ang problema, kung nakapasok sa atin early on, I'm not surprised later on kung may Indian variant tayo.
It's important to trace where the concentration of the variants are to contain its spread. The WHO has said the new variants are more contagious and could potentially burden the health system even more. Caroline Bongkin, CNN Philippines.